Hello, I'm Commissioner Emma Darnell. Welcome to Mighty Five Conversations. Conversations is a monthly information and communication program focusing on the sustainable community, economically strong, environmentally safe, with liberty and justice for all. The topic for today's conversation is partnerships in community health. What's going on? Thank you so much for joining us. I will be back in a moment. Joining me in the conversation today is Dr. Patrice A. Harris, who is the director of the Fulton County Department of Human Services. Dr. Harris is a graduate of the West Virginia University School of Medicine and completed residency and fellowship training at the Emory University School of Medicine. Welcome, Dr. Harris.
Thank you, Commissioner, for having me.
We are very pleased to have you join us today to help us disseminate information in an area that everybody's interested in, and that is the protection of the health and safety of themselves and their families. And of course, we know that based upon information that we receive from you, your department, and other public health officials, we learned, and I believe in 2009, that we had a serious health disparities problem in Fulton County. I believe it was 2009.
That's correct, Commissioner.
In fact, we scored F in this particular area. And at that particular time, I recall that you recommended to the Board of Commissioners that we look at the access which people have to information. And education and information and prevention, they continue to be major strategies for public health. Is that correct?
That is absolutely the greatest strategies for public health, is getting the word out, education, and developing strategies. It's about a population health approach rather than that one-on-one health approach.
I see. So as we approach this area of responsibility as a county, then we have to be concerned with more than just vaccinations and one-on-one approaches, which are still valid and necessary. But when you say population, that is, we have to think about information, large numbers of people. Is that right?
That is correct. You know, Commissioner, we have approximately 900,000 citizens in Fulton County.
Right.
And if we want to take a long view and think about prevention and chronic disease, it really is about educating the public and working with folks to develop strategies to prevent the future burden of chronic disease. You know, in Fulton, we have the greatest absolute burden of chronic disease for individuals with chronic disease.
What are those chronic diseases, Dr. Harris?
We're talking about diabetes. We're talking about high blood pressure. We're talking about the folks who have heart attacks. And you know, obesity is a driver for a lot of those diseases.
And when you say chronic, it means that we don't get rid of them overnight, do we?
Chronic, you are absolutely right, means long term. And so folks who are diagnosed with diabetes typically have diabetes the rest of their lives. And so it's about preventing that so that they don't have to deal with diabetes and cardiovascular disease, and then of course some of the worst outcomes, stroke, heart attack, and death from some of these chronic diseases.
Well, certainly in District 5 and in other adjoining districts, there is a concentration of chronic disease in this population. I recall that as we were preparing to expand and upgrade the Adamsville Health Center to a regional center, that the department conducted a very comprehensive assessment of that service area. And I recall that your findings included these chronic diseases. And that's when the terrible shadow of disparities appeared, because your study was not just focused on one area, you expanded it to really include the entire county.
That's correct, Commissioner, and a great point to focus on disparities, because sometimes if you look at some national rankings,
Yes.
Fulton County looks okay.
It does.
But that's the county as a whole. And as you know, disparities means the difference between people of different races and people who have different socioeconomic status and people who live in different areas. So while we may look good as a whole, there are significant areas in the county, your district 5, District 6, and District 7, where we have a high burden of these chronic diseases and then mortality, death associated with those diseases.
Well, that's what your investigation disclosed. And it's interesting that, you know, although many of us have tried to keep up with the information in this vital area for ourselves and our families, it's been the kind of investigation and work that public health officials have done that really has made us aware that these chronic diseases are not everywhere in the county. They are concentrated. They are concentrated in certain areas, and Districts 5, 6, and 7, the map showed that these diseases are concentrated in areas not only where most people are people of color, but actually in terms of income, it was not really a factor. I mean, you had, in other words, race seemed to have been a major factor more than income, because even in middle income areas, you still found this concentration. And that's why I believe that the kind of assessment that the public health officials do before they do programs is so important, because I think many people were surprised to know that even in middle income and upper income areas that are predominantly African American, or where you have predominantly language minorities, you find the concentration of chronic diseases. So that kind of investigation is important, isn't it?
Yes, you know, the core of public health is doing that investigation, that surveillance, we call it.
Yes,
because before you develop
yes.
programs, your program should be based on evidence and data and science. And so that prep work is what public health does. They find where there are areas of disease burden and find where there are areas of infectious disease. And then from that needs assessment, then you develop your programs and your strategy and your plans.
But that actually makes sense. That makes a lot of sense. You know, we wouldn't think about just running out trying to resolve a problem. I was trying to think of a kind of home-related problem, but I'm not too familiar with those. Have not spending much time there. But we would not think about going out trying to fix a garage door or anything else until we found out what the real problem was. And I think in government we can learn a lot from public health in that regard. You know, you don't just do something. You know, it's a reason why you're doing something.
Absolutely.
Which leads us to these programs that the department follows and is implementing in the area of chronic disease. Well, in many areas, but we're very pleased to have approved, the board recently approved application by the department to CDC for funding. I believe it's a small grant, $2 million, but it's certainly needed, right?
Absolutely, absolutely.
We recently approved the department's application at CDC for the Partnership in Community grant. Tell us about that program, because it does focus on chronic disease, and it is based, as you say, on evidence and not on just trying to have a program.
Well, yes, Commissioner, we're very pleased that the board approved us to accept the $2.9, I believe, million a year for the next 3 years.
Yes.
CDC, of course, is very interested in chronic disease and, of course, reducing the problems associated with chronic disease. And so last year they put out a notice of this grant. And it was a very competitive process. And
That's what I understand.
Yes, we work with our community partners. But I will tell you, Commissioner, your point earlier, you have to be prepared for these CDC grants.
Yes.
You have to have data. You have
Good
to have a
point.
proven track record, and especially now, there's partnerships in community health. So CDC expected jurisdictions to already have in place a track record of working with the community and good data. And so we were, with the board's approval, awarded the grant, and we're going to be developing, drilling down and developing programs that really reduce that burden of chronic disease by working to improve access to physical activity and access to healthy, nutritious foods, access to health care and partnerships. We want primary care to partner with public health and behavioral health.
Tell us about what is primary care, because you said something there that I think is extremely important for us to understand. My mother often said to her friends, you go to the doctor too much. You can do some things for yourself. Tell us what you meant by that, how, working with primary care, we can achieve the results we want in these areas.
Well, we know that data supports that in order to make a dent in the health disparities, it's not just about, it's important to go see your doctor and take your medications, but it's broader than that.
It's broader than that.
It's tackling those social determinants of health.
We want to talk about that when we come back. They're signaling me now that we've got to take a break.
All right.
But I'm anxious to get into those other determinants.
That's right.
Thank you. Dr. Harris, you were saying that while it is important that folks adjust their behavior where necessary in order to achieve results in this area, it's not really all about just behavior, is it, as we approach this extremely important area of chronic disease in this community?
You're right. It's about behavior, but it's more than that.
It's more
about
than behavior,
the environment.
Mm-hmm.
Sometimes, Commissioner, if we focus on behavior, we end up blaming the victim. Oh, you didn't go to the doctor, and you didn't take your medicine.
Oh, yes, we do. Oh, you smoked.
Right.
And we do want to stop
We
smoking.
we do.
It's just not the whole story.
It's not the whole story. And we talked about primary care, and just think about how often we go to the doctor. Maybe once or twice a year. If you have a chronic disease, maybe once a month. But what about all the other time that you're in the environment? And do you have access to healthy, nutritious foods? Do you have access to physical activity, which is as simple as just walking around the block? Is it safe? Are there sidewalks? Is it well lit? So it's really about addressing and increasing access to go see your primary care doctor, go see your behavioral health care therapist or psychiatrist, but also what should we be doing in the environment? We should be making it easier. We should make the right thing to do the easy thing to do. We should make it easier to exercise and easier to cook healthy meals. So it's more than just the primary care, and we want the primary care to have linkages to public health and community programs that can help with that chronic disease.
Very
Yes.
good point.
Yes.
Because it's all a part of a total system, isn't it?
A total system.
I know that the Fulton County Department of Health Services has a very active and effective, in my opinion, program in the area of environmental justice. And it sort of links into this whole comprehensive program to reduce health disparities, doesn't it?
It's a critical link.
It's a critical part, and I understand that that's the point that you're making now, that even if you stop smoking and even if you walk and eat the right foods, if your air is dirty, if your water is dirty, if you're living within a half mile of an EPA permitted facility, then the risk to your health increases. And so it seems as if this blaming the victim without looking at other public policies, such as land use and zoning policy, might not be the answer. Let's talk about this program that, and I stand corrected, Fulton County really has already been evaluated by CDC along with others who applied for the grant, and they have made a decision based upon our record and our ability to move forward. And I certainly cannot argue with that, because Fulton County is also a grantor,
Right.
in addition to being a grantee. And under the circumstances in which we operate today, in terms of having adequate resources for in this area, we almost cannot afford to support programs that have not been able to show us that they actually achieve their objectives. We don't have that choice anymore to develop programs with no record. And so we are very pleased that the Department of Health and Wellness, you have other grants that you've received from CDC. We were very pleased that Fulton County, along with DeKalb, were two counties that were selected by CDC for a major grant in the area of HIV/AIDS. Tell us a little something about that program.
Yes, when we think about chronic disease, we certainly have to keep these days folks who are living with HIV and AIDS, because that is a chronic disease.
It's a chronic disease.
It is a chronic
That's
disease.
right, because we're living with it.
We're living with it now, you know,
Yes.
which is a vast improvement
Oh,
over
I
the
think it's
original
tremendous.
days. So it
Tremendous
is,
improvement.
yes. And so the CDC, again, several years ago, put out an opportunity for prevention, because we want to
Yes.
prevent it.
Yes.
And we do know that treatment is prevention of
Yes.
new infection.
Yes.
And so we were awarded a grant along with DeKalb County. So we are the fiscal agent, but CDC has charged us with working with DeKalb and working to prevent future HIV infection.
Well, we certainly, the board is certainly encouraged by this additional support from CDC, because I think we still have a little ways to go in terms of our state support in many of these areas. But back to the partnerships in community health grant. Tell us about that program. What will we be doing? You've indicated that the whole idea is to communicate to people the kind of information they need to know, to have in order to deal with diabetes. I think you have a special coalition of community folks who deal with diabetes only, right?
We do. We have a coalition of folks who deal with just diabetes, and one that deals with cardiovascular disease.
Yes. All of these chronic diseases.
Yes, all of the chronic diseases. We have one subset of the group that is targeted or works on partnerships with faith-based organizations.
Yes, yes.
So building on that success, and this comes, Commissioner, out of the directive by the board in 2009 to really bring the community in.
Mm-hmm.
You know, Fulton County can't do it alone, and so we've been doing that since 2009 and building these community partnerships. Our particular program we entitled Growing Healthy Fulton.
Yes.
And we're going to build on the success of working with community coalitions that we have, and we want to do further engagement and outreach. We're not done yet.
Mm-hmm.
And we're going to work with the municipalities and encourage policy.
I'm glad to hear
yes,
that. Yes.
Encourage policy development around a complete streets policy, which means
Yes.
the streets are not just for driving. Maybe we can make
Yes.
our streets and the associated sidewalks for available for biking and walking. Policy development and programs around that community care linkage regarding diabetes. We want to increase access to folks who live in food deserts, farmers markets. We want to increase, maybe the corner stores can make a concerted effort to have healthy fruits and vegetables. So those are some of the programs that we'll be developing with this grant funding.
So it gets down to public policy too a little bit, doesn't it?
Critical. Policy is critical.
Well, many of our programs have outstanding community volunteers and participation, and the Division of Health Services has some of the most enthusiastic and the most persistent and insistent. What are some of your techniques you have in this department? Some of, I think, and many others, some of the most effective community advisory groups. What do you all do to get the word out and get these folks involved like they are?
I think it starts with the dedicated staff, and we have our health promotion that has
It always
many
starts
staff.
with leadership, doesn't it?
Yes, who are dedicated. I think the other key thing, Commissioner, is not having a we know better than you approach.
That's important.
We try to have the opposite approach. You tell us, you work with us, you know better than we do what strategies will work in your own community.
And it's the truth.
Yes.
We aren't just saying that.
Right.
We find that it's true in the development of public policy. If you just listen, you know, some of the best ideas come from the community. But go right ahead. It's the approach of government that determines whether or not working with the community is going to be effective.
Yes. And making sure they feel like they're equal partners.
Yes.
Again, that we're not the boss of you. You know, we're not the boss of them, but they're equal partners. And again, we value their participation. And in fact, with this grant, we had developed some just very generic partnership agreements, and that was a critical part of this grant. That
interesting. Actually, something on paper that's kind of generic, but a real partnership.
Yes,
I like that.
Yes.
Yes. So, well, we might have to borrow from public health on that. See, can we do some of that? Well, Dr. Harris did give me a signal that we've run out of time. I just can't believe that we've finished. Because I know certainly the viewing audience would like to know more, because there's so many people out there who really want to contribute, they want to participate, they want to be a part of our team, you know, but they must be respected, and we must get the information to them. And we are so pleased that the Department of Health Services has been so effective in this area. We thank you very much, Dr. Harris, for coming in today and letting us know about this new program, this new grant from CDC that's going to help us move further down the road. We've come a long way since '98 when you all, when we received the news, well, 2009, when we received the news that we had received an F in health disparities. I think we probably at least moved to D by now, but anyway, we won't speculate. But it has been because, as you say, because of dedicated staff and because of the effectiveness that you've had by understanding that it doesn't really come from the top down in our business. It comes from the bottom up, doesn't it?
Yes, it does.
But thank you again, Dr. Harris, for
Thank you,
coming in. We
Commissioner.
appreciate it. I'll be back in a moment with closing thoughts. For many years, we have been advised by public health officials that information and access to information is critical to the reduction and elimination of disease and health disparities. It is for this reason that, in coordination with state and federal officials and with the community, the board has given the highest priority to programs which focus upon information and prevention. However, the evidence also indicates we must be careful that we do not confuse the programs of government with the purpose of government. Programs are essential. The work must be organized in a cost-effective way to achieve specific goals at a time certain. However, the basic purpose of government is not the implementation of programs. Government is about people. And if it is by and for the people, then the programs will take care of themselves. That's all the time we have for today's conversation. Until next time, stay strong. To learn more about today's conversation, contact me at 404-612-8222. That's 404-612-8222. You can also email me at emma.darnell@fultoncountyga.gov. Visit us online at emmadarnell.com or connect with us on Facebook or Twitter.